afternoon, everyone. Welcome to today's webinar hosted by Patagonia Health. Today's webinar topic is on doing more with less, how small health departments are thriving in 2025. If you aren't familiar with the Zoom webinar platform, take a look at the control panel at the bottom of your screen. Here you can configure your audio settings, send chat messages, and ask questions. Hopefully this is going to be a really interactive session today, so go ahead and make sure that chat button is working. You can go ahead and type what state you are joining us from today. I think we got people from all over. The format for today's webinar is going to be slightly different than our usual ones, but we're really excited. We have some awesome people on our panel. We will first hear from Lakeisha Bird and Jolie Rollins, who will provide some background on common challenges small county public health departments face in 2025 specifically. They will share tips on how technology can help super small teams do more with less bandwidth and resources. After they speak, I will let our small county representative introduce herself, then we'll go into the Q&A section. Thank you for the questions you have submitted beforehand, but if you think of any additional questions, feel free to leave them in the chat. We will try to get to as many as we can. Without further ado, I'm going to pass this over to Lakeisha.
Good afternoon, everyone, and thank you for joining us. I am Lakeisha Bird. I'm a senior account manager, and I want to just kind of talk about things from my experience. Okay, I'll be covering a couple of topics, and those will be the importance of a scalable and easy to use solution, as well as try to debunk a few myths about EHRs being too complex for small health departments. Okay. We understand that the important work you do, there's no doubt about you all do important work, but sometimes this work is being done with a smaller staff. Okay, so we're going to kind of just have a discussion today. All right, so let's talk about the importance of scalable and easy to use solutions. This will allow practices to be more efficient to serve their communities and patients. Okay, so let's just think about all the things that you do in your practices, and you may need a solution to kind of help streamline all of that work. You can grow without adding staff. This investment for your teams will implement technology and automation, like I said, to streamline your tasks and optimize your workflows, right? There's several and many steps to all the work that you all do, and making sure that your system supports that is very important. You can do more with less. So that's what we're talking about today, right? More with less. So if you only have a few staff, an EHR can help in many ways, such as system documentation versus paper documents that may be being used. Removing paper reduces maintaining and tracking a paper record and document it all in one place. Everything is in the same place. I can go and look, Jolie can go and look, and it's all the same information in the same place. All right. Let's focus on simplicity. How many screens to schedule? How many steps is it to refile a claim? You know, during your search for an EHR solution, ask yourself a few questions, and I have a few here to think about. What do we actually need in an EHR as a smaller practice, right? So they come in all shapes and sizes, right? So how much do I actually need to get the work done? Does this EHR make our workflow easier? Is it only taking 3 clicks to get where I need to go? Or do I need to go to 5 screens to get the job done? You think about all of these things. Will the system be easy to learn for the staff? Just like practices are in all different sizes, we have all different, types of users, right? That there may be a little challenging to understand the system software, or someone that may get it very quickly, but you know your staff better than anyone. So you want to make sure that you get a solution that fits them. Okay. And if we have questions, will we have the support that we need to get those questions answered? That's a big one, right? Making sure that you can reach out to your EHR solution to get the answers that you need for whatever might be going on. All right. Okay, let's talk about some myths about EHR, or just, I understand where everyone may say, oh, we're too small. We're only a 5 or 6 user practice. We don't need an EHR. You most definitely do, right? Any reduction in staff effort is impactful, so even if you are a 6 user staff and you go down to 5 users for a temporary reason, having that solution and those workflows to back you up will then be able to help you onboard the next person that comes into, there could be staff turnover, any reason, right? So a reduction in staff is impactful, but with an EHR solution, once again, everything is in the same place, and then you guys can kind of work together to get the work done. Is it commercially available off the shelf? So an acronym for that is COTS, right? COTS. So that means that it's ready, not much customization has to happen. You ready after training, there you go. You ready to take off and start using that product. Cloud-based can be a light IT option, right? Light IT footprint. So it reduces the need for IT involvement, infrastructure, and equipment, right? So does my EHR have, once again, everything that I need in one solution? Or do I need to get this solution, then get this solution to be able to get the work done, right? So think about your needs and think about the cost of those needs. Too many screens and steps. We talked about this already. Streamlining your workflow means a higher user satisfaction, right? It's not taking me 3 hours to see a patient, right? It's just taking me a few minutes, and I'm able to get this done very quickly because everything I need is right there. How awesome is that? All right. And higher user satisfaction, easy to train and retrain. All right. And training is too difficult. With only 5 or 6 users, training will be hard for us. Maybe you can get that done in a couple days. If it's a easy to learn solution, you don't have to be down for weeks. Use that time to work with your trainer to have more impactful workflow and not necessarily learn how to build the system, right? Once again, going back to COTS, it's ready. You're ready to train, you're ready to use. So in my experience, it is helpful to have an EHR. I've worked with many small practices to kind of help get them on board and ready to use it. And, it's not always easy, but the challenge, once they get over that hump, it's a great thing to have. All right.
And Lakeisha, I'm gonna tell you what I used to tell people. I was a trainer back in the day,
Mm-hmm.
and I used to say the first week that you use it, it feels like you're typing with mittens. The second week, the mittens come off, and now you got gloves. The third
Right.
week, everything comes off, and you're cooking like you've been using it your whole life. So hopefully, and it's actually a little less here. That was 20 years ago when I was a trainer. So Elizabeth is shaking her head, so I think she knows exactly what I'm talking about.
And change is not always easy, but once you get there, that's just like switching phones, right? Going from an Android to an Apple, you're going crazy, right? But once you start using it for a little while, you're like, okay, I have this, and I'm gonna tell, before I turn it over to Jolie, I'm gonna tell this story because it's fitting right now. So there was, I was training a particular group, and we were at their go live. Everything was cooking, and then this form came up, and they were like, "We didn't think about this form, this orange form. We need to make sure that we document this form." And I'm like, "Well, let me look at the form." So I look at the form, and everything that
Ooh, ooh. Let me turn off my video. Hold on.
was on the form was in the system, and I'm like, "That's on this form is in here." And then after a while, it kind of sunk in, and they were like, "Oh my goodness, it is in here." So I said, "Get rid of that form," right? So things like that, like decreasing those steps by, having your EHR system is everything. All right, Jolie, I'm gonna hand it over to you.
Turn it on to me. Awesome.
Okay.
Thank you. I had to cut my camera off because I think I'm having bandwidth issues, but that's because I'm at home. So I'm Jolie Rollins. I'm the sales engineer here at Patagonia Health, but I've been working in EHRs for over 25 years, probably more, but let's just say 25 for now. And the role that I've enjoyed the most is the role that I have now, where I listen to the customers and hear what concerns they have, what workflows are working, what workflows aren't working, and then help them understand how we might possibly be a solution for that. So I've been here almost 7 years. I can't believe it. And I wish I had started my career in public health because it is an absolute delight to serve those that serve the underserved. So I appreciate everything that y'all do from the bottom of my heart. It means a lot. So some of the consistent things that I see when we're talking about small local health departments, some challenges that they may have is just doing more with less, right? So you have to be able to do more with less staff, less resources, etc. And so I think of things like, could a portal help offload some of that work that we see at the front desk, right? So could they check in for their appointment? Could they sign consent forms? Is that something that the vendor offers that is going to help me do more with less? So those are a couple of examples. Some of the things that I think about that you should be looking for would be consolidation of technologies, right? And I'll use Clearinghouse as an example. And I mentioned I've been doing this for a while. So what happens with the clearinghouse when it is not embedded into the software? There's a couple of things that are going to happen. One, you're paying another vendor. Two, there may be transaction charges, which is not really how we can do things in public health. We need to have total cost of ownership. We can't keep getting these little transaction charges every month. So it needs to be all you can eat, if you will. And so some of the things that I think that would be helpful to be consolidated, an e-fax, right? An electronic fax. We don't need to have the machine and feed it paper anymore. The clearinghouse being embedded, that's going to stop the hot potato, is what I call it. So a claim gets denied and your clearinghouse says, not my problem, right? And kind of shoots that hot potato over, and your other vendor says, not my problem. Well, then you have to take your time and get both vendors in the same call and have them duke it out. You'll never experience that here, but those are things to be looking out for, right? So we don't want the hot potato. The e-prescribing, right? So is it embedded? Do I have to go to another site? Is it all on one screen? And again, the transaction charges, right? So that was something when I joined Patagonia Health over almost 7 years ago that I didn't understand how you needed to have your contracts work. And we can't have those transaction charges for you. So those are good questions to ask. And Lakeisha kind of hit on this too, which is, what do I do when staff leaves? How do they get that core training that that I had from the Patagonia Health team, or whatever vendor? I keep talking about us because that's where I am. But what the vendor, right? So how does the vendor offer to get new folks trained? I will tell a story. I used to be a brownie. I never graduated to Girl Scouts, but in brownies, we used to do the tell. You tell the telegraph. So you tell a story and it goes around the room. And by the time it gets back to you, it's not even the same thing. And I think that peer-to-peer training on the core software, I think sometimes it loses some of the things, right? So sometimes I'll hear folks say, well, I didn't know we could do that, right? And it's because of that telegraph, we didn't get back to the core training there. Some other things that I've seen, some trends and things that I've seen in public health technology adoption would be patients are more willing to use technology, right? So, for example, nobody wants to go in and touch a pen of unknown origin, a clipboard, or anything like that. So, there's been this shift in the population, in our patient population, that now wants to do things online and not have to go into a clinic and touch things. Referral management, right? So, in public health, we do a lot of case management, care coordination, and things like that. So you want to ask, what's your solution for that? How easily can I find the patient? what referrals I have made, what's the status of those referrals. So how easy is that? And then that sort of tasking and alerting, that other stuff that we do. So is there a caseload app, for example, right? Is there a place where I can see all the patients that are assigned to me and my care and things like that? I will tell another story, if that's all right, while we're getting some questions together. I've dealt with, in the past 3 months, there has been something that just warms my heart. So we've had existing customers reach out and they're adding other departments, right? So we've had a lot of case management added, a lot of care coordination, and they didn't realize that their existing solution was able to provide those features and functions. And so in most cases, it's only required a user license because we're adding more staff, but we've been able to add those additional programs and create those workflows that they already have today, except for they're not on spreadsheets, and they're HIPAA compliant too. So that absolutely matters. The other thing, as a trainer, as a former trainer, I'll say, who builds your templates, right? Who builds your documentation? Because those can have reporting and billing ramifications. In a past life, I taught a template builder class to 3 days, and they had to travel to me, and it was mostly MDs and nurses, right? It was the worst use of their time, y'all. I'm not going to lie. First of all, they didn't know what they were doing when they left. They were in no way proficient at doing that. It was a waste of their time, and I felt bad that they had to incur those expenses. But this was an ambulatory. This was not in public health. So the question should be, who builds my templates? Who updates my templates, right? I'm a newbie. I might be winding down one system, even if it's paper, while trying to learn this. Understanding how to build an EHR is really one of the last things that I need to be burdened with, because I'm too distracted. There's too many things going on. And I'll give you a hint. You only build it once, right? You may maintain it, but you only build it once. And then the other thing that I'll add is, how is training going to be delivered? Are they going to do it on site? Are they going to do it remote? Is there a hybrid where maybe we do some offsite, where we do some remote training for the pre-live, but then you want somebody physically there on site when you go live? It doesn't matter how big or little you are. I would say when you're little, you need more support, right? Because you may have 4 or 5 jobs that you're trying to do. And so you can't be the troubleshooter for everybody else. You need somebody to take the wheel for you. So those are just some of the things that I've seen. I love it when our small health departments say, "Can we do this too?" So they're growing, right? They're able to continue to add services and things like that. So that's kind of my story there.
Can I add something, Jolie? So,
Please.
and I was a former trainer, and for many years, and just a little bit about my background, I've been in the medical field my whole career. So I've worn many hats. But I will say that during the implementation of your solution, whatever solution that is, your implementation team should really be your best friends at that time, right?
Right. Yes.
Someone you can reach out to, your project manager, to maybe get an answer. Your trainer will work hand in hand with you and not let you go until you're ready. You want to make sure that you have that connection to the implementation team and to your trainer, because they are there, or should be there, to help you get through and get over the hump to get to where you need to be with the solution that you have decided to purchase. So just adding that, it is very important, and they should be willing to do that for you,
Yeah, the
right?
collaboration,
Mm,
right? Because they are your best friend. Y'all got to collaborate on what you get.
you're gonna work some things out together, right?
That's
Right.
exactly
So yeah. Okay.
right.
Okay.
Great. Well, thank you so much, guys, for your insights. And now we're going to get into kind of the meat and potatoes of today's webinar, which is our Q&A section. So before we start going into the questions, Elizabeth, I'd love for you to unmute and introduce yourself. Say a little bit about yourself.
My name's Elizabeth Sheldon. I'm from Lincoln, Kansas, Lincoln County Health Department. We're a small county. And yeah, I'm going on my 3rd year of being the administrator. I was just a nurse
Just a nurse.
just a nurse before, and now I'm a nurse and the administrator. So, but yeah, so I'm glad to be here.
Awesome. And how many staff do you think are at your health department right now?
Well, we originally started with 4, went to 5, and now we're down to 3.
All
Yay.
right. Man, well,
Never happens, does it?
right. Thank you so much for what you do for your community.
Thank you.
Okay, so we are going to start our panel discussion with the questions that were submitted upon registration. Like I said, this is an interactive session, and now I know that your chat button works. So use that chat button and put in any additional insights you have into some of the questions. I would love to learn from each other, right? So we have people from all over: Colorado, Ohio, Georgia, Oregon. So, what works in one state might work for another small county health department in another one. So, this is going to be a great opportunity. So, the first question that someone submitted is for Elizabeth. How has an EHR improved productivity and efficiency for your health department?
It definitely has kept everything in one spot. We have charts. We don't have number one, and probably the biggest thing is that we don't have. Although we have to keep paper stuff, but really downing that paper work because all of our charts are in the EHR. So that is a great thing. So that's huge. But also, yeah, charting as a nurse, that is easy peasy. So that makes it really easy. And then it sends it to the ESB, and then our biller is able to just shoot that out. And so, yeah, so that's how it makes things go a little bit smoother, and not so choppy, but yeah.
Yeah.
So
And as you're
less.
talking, oh yeah, for sure. As you're talking about billing, somebody else asked about billing specifically. And maybe Jolie, you could answer this one. Is the claims billing 100% staff responsibility, or how does the EHR take care of the claim once it's been submitted?
Correct. Yeah, that's a great question. So, with our solution, our clearinghouse is embedded and it's included. And that simply just means that you don't have to have a sticky note or a piece of paper with with a bunch of different portals and things, different portals that we have to go in to submit those claims. That makes it very efficient because you're not having to toggle between two, and they talk and communicate together. With our system, and I said this on a demo with one of my sales reps, and he, bless his heart, he said, our billing is so easy. And I was like, slow down, buckaroo, because billing is not easy, right? We have easy to use tools, but you still have to do the work. You still have to work the denials, the rejections, the refiles, and all of that. We've just provided very efficient tools where you're on maybe 1 or 2 screens to do all of those type of activities. You're not, for example, like I think Lakeisha said, 5 clicks to refile something or 5 clicks to submit claims and things like that. It's one button. So we try and make that easy, but the staff will be the ones that are responsible for that. In the smaller health departments, I've seen a couple of different things. So, for example, sometimes they have somebody in the county finance department that is going to log in and help them with that claims processing. Other times they may have a staff identified that they think can handle the billing process. And that may be true. I would say you probably have really good or local technical colleges where you could send somebody to get some of that billing expertise just to kind of get their processes in place and kind of understand what ICD-10 is, what's a CPT, and kind of get their basics. There's online courses and things that are very affordable, so you can take somebody who may be a front desk person but has an affinity for process, has an affinity for using the system, and maybe somebody that can take over that process. So specifically for us, we have really easy tools, but the process of billing can be quite complex. So we'll happily work with you to make sure that you get a good process in place.
Great. Now we're going to talk about the calendar. Elizabeth, maybe you can share a little bit, and then if anybody else has any tips or somebody in the chat has tips, do you have any scheduling tips as a small health department, or how to organize your calendar better?
So we really like the calendar because obviously it allows people to see what we're doing and when we're busy or whatever, and how to schedule patients and clients. So the nice thing is that Like we can do color codes for like specifically, like if I have a class, if I'm teaching a class, then that's color coded. And then we can allot out how many if it's an hour or 2 hours or whatever. And then so yeah, and then each person has their own column, which is nice. So you're able to see just your own or everybody's, and that kind of helps out. And it also helps us, like when we have other people come into our health department, like we have a hearing aid man, we have mental health come in, we can block off a room for them and know that and so we have that on our calendar, so that when I answer the phone, I don't schedule somebody for foot care during the mental health because we don't have a room open. So that is wonderful. So
Good stuff.
Yes. Yes.
And Elizabeth, did you have to hire a full-time administrative person to manage the EHR? I'm assuming I know the answer to that one.
no. No. I had just caught they were actually just training when I came on board. The administrator before me was still on. So I went in the training, and then when she left, I just kind of took over that. So I would thankfully, I mean, I wasn't really in on kind of like the setup, but I got the training. I think Lakeisha, you were the one that trained us, I'm pretty sure. So
that wasn't on purpose.
So anyways, but yeah, no, so then I'm just kind of taking over that with that too. So but yeah.
Nice. Yeah, small health department, you got to wear multiple hats.
Yeah.
So that somebody submitted a question I wanted to ask, but I was like, I think I know the answer to that one. Okay, so there are some questions in the chat. Somebody is asking about reporting tools available in the software. If Jolie or Lakeisha, if you have any insights onto reporting.
I'll let Jolie take that one.
I was going to say, so we've got several different types of tools. Specifically with Patagonia Health, our two specialties are public health and behavioral health, and maybe that's something you might want to ask as well too. How many different specialties do you serve? But I will say 90% of our customer base is public health, right? So I think we're in 510 counties, 38 states, and Puerto Rico, and so that's state and local health departments of all varying sizes there. So our tools, we've got some canned type of reports. And so think of these as like your statistical reports. So I need to see services by location, by provider, by program, etc. Vaccination reports. So I want to see VFC, how many VFCs did I do? And then we've got, so those are some of those type of appointment reports where we can calculate the show rate. And so sometimes the board needs that type of information. But then we've also got an encounter note report writer. So at Patagonia Health, we build your encounter notes for you, right? Because it does have billing and reporting ramifications. And so we don't want you to get to the end of a period. You think you've collected everything and you have not. And so the encounter note report writer allows you to data mine in the encounter note area. So that allows you to pull out that type of data. And then we've got an ad hoc report writer, and that ad hoc report writer allows you to run, and you can do cross tabs as well, but it'll help you get a patient line list for things like by program, by problem, by medication, by test result, by vital. Let's see, immunizations, procedures, family history, all of that can be data mined. So if I needed, maybe we're getting ready to start a pre-diabetic education session, and we want to see who would be part of that. So I might run a report and see everybody who has a hemoglobin A1C of 6.1 or higher, that is also, has a blood pressure a little elevated, 130 over 80. So I can get that line list of patients, and then I can send what we call bulk messaging, but it's really patient engagement, and say, hey, and this actually happened in one of our Michigan counties. They had a local chef who was going to come in once a month, and he was going to show our pre-diabetics how to shop and prepare healthy meals on a budget. And so they were able to broadcast that to all of their folks and say, it's free. Come on in and let's get you some education on that. Then we've got the complement, obviously, of the financial reports, right? So we want to see how much, our AR, how are we doing with that, different services and things like that. But we understand programs, we understand VFC, we understand 340B. So these are not foreign words to us. So you won't have to call support and go, okay, we're public health department. And VFC, that stands for Vaccine for Children. 340B, that's how we dispense. So we speak your language, and I think that is somebody that you want to look for. If you have to explain what FPAR 2.0 report is, then that might not be the vendor for you, right? They may not understand that those reporting constraints change all the time. That's standard for us, right? So we're going to include your FPAR reports, and we're going to include updating them annually as well.
Awesome. Thank you. This is kind of a hot topic right now. Somebody submitted a question about budgeting, especially, this year with some uncertainty in funding. What can health departments do as a whole to budget their funds appropriately, regardless of their size? Elizabeth, do you have any experience with any like funding or any requirements there?
I mean, yes. I mean, that is probably one of the most difficult things about it, is because, when COVID happened, obviously they threw all this money at health departments and public health and said, here you go. And so it gave us the opportunity to buy an EHR, to get an EHR. And then now they're taking all that away. So it makes it really difficult to kind of navigate that. Obviously, we don't want to get rid of what we've already just, have started. So that is the difficult part. I don't know the solution to that, because right now, I'm in that boat where pretty much all of us is where they've taken away the funding that we were funding it with. So now we've got to figure out other ways to find that funding. So
now, Elizabeth, I'm going to ask, are you the grant writer as well?
I am.
How many hats does she wear? Oh my goodness.
Right.
I told you, squirrels, lots of squirrels running around.
And I think too, on this topic of cuts and funding, is that if you're in the market for a solution, just make sure, like Jolie mentioned, that it's compatible, right? And what exactly do we need to do our jobs and be successful, right? You don't need to go out and purchase all these features that they may have if you don't really need them. So having that option is helpful as well, because it may be something that you can add on later, right? When things change, or you get an awesome grant that Elizabeth is going to write and get all that money, right? Then you can come back and say, hey, now we have a few extra dollars, we want to add on a feature, right? So I think making sure that you actually get exactly what you need during these times, and not more, may be helpful as well.
For sure.
And I think too, if you get, because some counties do not bill, they do not want to bill. I would say if you aren't billing, that's an opportunity to edify your programs and to potentially be able to add more programs. I'm here in the state of North Carolina, if you couldn't hear my accent, and we have a lot of our local health departments that are using Patagonia Health have a additional primary care that supplements what the public health does. So they offer, the fee for services, normal, traditional public, primary care, and then that helps fund the public health side of it. So if you're not doing that, it's something to consider. And I know it's a lot, but it is something to consider. You're leaving money on the table.
At least for the payers that are popular in your area, right? Say you have a lot of patients that come in with Blue Cross Blue Shield, then that may be one that you want to look into, right? Being able to service those patients, keep that money in-house, get contracted with that payer to then be able to send claims over for reimbursement.
All right. In the chat, there is another question about statewide reporting. So we know that public health is its own unique situation, but what about statewide requirements in addition to the other public health stuff. So
Yeah. So, let's talk about the immunization registry, right? So, 90% of our customers, of our clients, are public health. If we can't connect bidirectionally to the registry, that's table stakes for us, right? So, we've connected to all the different states, and that is bidirectional, meaning I can download the history. In most states, we can see the recommendations or the forecasting that's provided by the state if they allow that. Most of them do, but also sending it back to the registry. So the bidirectional is getting the history, showing the recommendations, and then as you administer, you save and it automatically uploads to the registry. So I think those are kind of the things that we need automated, right? That's where you need that automation. Other things that you may want to do, if your state allows us to, or allows any vendor to connect to the state labs. We're underway. We're on a 2-year project now in North Carolina to connect to our state lab that was funded by COVID, which we thought was pretty nice. I know Elizabeth, where she is in Kansas, they have a very unique, I love your strategy. They have one backbone and they've got the state lab there. They've got the HIE. They've got, the immunization registry. So they really streamlined it and thought about how their public health departments could connect in a more efficient type of way. But then, think about your other types of reports that you may have, like family planning. How can you submit that data? Is it possible for us to upload that data for you? How are you currently submitting it now? So we definitely want to keep you in those automation things. The last thing you want to get to, if you've ever had to do that, where you have to look at the data and I'm looking at you, Elizabeth, because I'm sure that was painful trying to pull it from those paper charts, where we may have an access database that's not HIPAA compliant, or an Excel spreadsheet also not HIPAA compliant, where we're entering that data because we can't get the number of VFCs that we did this month, right? As just an example.
Sure. Thank you.
I would add that, like, part of our biggest is that the immunization, that's huge.
Yeah.
Like that it goes to the state, that's ginormous. And then also our inventory, like keeping our inventory, whatever we have as private, we keep an inventory in our EHR system, and that helps out greatly. So
Nice.
And not just, inventory on medications and vaccines.
Yeah.
You think about that, right? So for family planning meds, have an inventory to manage those, as well as for your vaccines, your VFC, all of your private, all of those areas.
Okay, let's go to another one of the ones submitted. For Elizabeth, do you have any other tools or resources that you have to boost efficiency? A lot of people are asking about how can we be more efficient with less people. So do you have any other tools, resources, or tips on how to boost efficiency?
Well, if anybody knows of one, let me know.
Yeah.
Right now, I honestly, I come very, very blessed because I have a team that, there's only 3 of us now. But the 2 that are with me, they've been here, like one's been here for 36 years and the other one's been here for 22 years. So I am definitely the baby, and they keep me on track. Because my baby squirrels are just going everywhere. So honestly, that's my biggest thing, because in public health, really, there's so many different avenues we can go, and so you're constantly being thrown things that, like, oh yeah, that's a great idea, let's go that way. So biggest part is staff, and then you got to remember just who you're serving and what's the most important. And that's what they do for me, reminding me of that, because I try to go every which direction. So as far as proficiency, just do the best that you can. Definitely, I would say, for me, but now I am one of the younger ones, and so stuff on computer is not hard for me. It's harder for my cohorts, but it's nothing that they can't do. And so, like, I might do like a cheat sheet. Oh, this is how we do our encounters for for immunizations or for foot care. I do that. Well, then I share that with my cohorts, but they might like, I don't really understand that one. So I'm going to make it like this. So, but we're constantly going back and forth. So if they find some way that's more proficient, then by all means, then as long as we are getting it in the chart and to the ESB and getting billed, that's all that we really care about. And the patient's being taken care of. That's so
Awesome.
I don't know if that answered the question, but that's how it works here. So
Yeah, that is helpful for sure. We probably have time for one or two more questions. If anybody has any more, feel free to put them in the chat. This one we have, speaking of staff, maybe Lakeisha knows about this. How do you handle staff training and onboarding, especially with limited resources?
Like I said before, I think it's working very closely with the project lead at the practice, making sure steps are very clear, what we plan to do next, make sure that they understand what from our end of this as well, what we need to help make sure and ensure that you're successful, right? So if we say, well, I need 3 days of your time, right, to get you trained. Find 3 days in your calendar. This is when we can do it. Shut it down. And then we're in it for 3 days, right? Answering all the questions, going through the workflows, making sure that you completely understand the product to then be able to, what's next? Do I need to build my calendar? Do I need to, like Elizabeth was talking about setting up her calendar. Do I need to make sure all my claims have been billed? All of these steps, you work closely with your trainer to do that. And even if it's a small group, I think with that, they wear many hats, right? So Elizabeth might be at the front checking patients in one day, which is not something she normally does, but because we train together as a unit, she understands that piece, not just the administrative piece. The finance piece, or just making sure from a leadership level. She also understands what's happening with her staff and what needs to be done. And I think that builds a very cohesive unit, no matter how many staff that you may have, because everyone understands from front to back, this is the expectation. Okay.
Awesome. Thank you. Elizabeth, how do you manage IT support or tech issues without a dedicated tech team?
Okay, so that's a great question. So I try to work through it, and if I don't know the answer, we always reach out. Like there's a help button on the like for Patagonia, there's a help button. We can go into that help button, make a ticket, have them help us. We are also contracted with Next Tech, and so like if it's like on our side, then they help us with that. But like if it's in with our EHR system, then I just use the help button, or I call and somebody can help me with that. So there's also a chat where you can chat with them, and so that's kind of nice too. So
I will say one cool thing about our support team is that they know the system because they use it all the time. And sometimes you don't always get that with support teams. They may be, overseas or have not used the system before. And that's something that we make sure our support team knows our system really well.
Definitely.
All right. Okay, let's do one more and then that'll be it. Let's see. How do you evaluate or justify the investment in an EHR with a small staff and budget? Maybe Jolie can take that.
Yeah, I think, we always have to justify, no matter how good or bad the times are, we always have to be able to justify. And I think that's where you work with your board or whomever is your governing body, and you talk about the problems that you're having, right? So maybe it's just a basic workflow analysis, right? We make this appointment in Outlook, for example, and then the patient comes in and now we're on paper. I can't tell you how many appointments we did today because it's not a report that's coming out of Outlook. I can't tell you how many VFCs we did. I can't data mine any of those things. So I think it's really critical to understand, what you need to do today, but also looking for those growth opportunities where you don't have to spend any more money. You can provide more services, potentially generate some amount of revenue, and then be able to edify those additional programs that you're adding. So I think it's really just having a good partner who can help you sell it, if that's the right word, to help you kind of understand where those efficiencies can be. Things like just as simple as checking in a patient, being able to e-fax from within the solution, being able to e-prescribe within the solution, or at the very least download medication history, which we can do from SureScripts. So I think that's really where you want to look at is, how do you sell this to your board so that you can get that funding that you need, and being able to articulate what those, the areas that you have where you're struggling, where you're going to need assistance. And I think sometimes I worked with a lady in Texas who was fabulous. She had 2 Access databases and an Excel spreadsheet, and it was just all over the place. She could never get her arms around what was actually going on. And it was very quick once they went live for her to say, I can get rid of these Access databases. I can get rid of these Excel spreadsheets. So now, instead of chasing squirrels like Elizabeth, you could hone in on running things more efficiently. And I'm totally picking on you. I hope that's okay.
And there's a saying that we like to say here, is the juice worth the squeeze,
That's
right?
it. That's
Is it worth is it worth us bringing this on? Is this going to streamline our workflows? Is this going to make us more efficient? Is this going to allow us to get this report? Is it going to allow us to be able to send these immunizations over to the registry without having to manually type them in to the registry every day for every patient? Is the juice worth the squeeze? And usually it is, right? It may not be easy to picture right away, but once you get in there and get it figured out, it definitely is.
And just getting rid of the paper. Elizabeth, didn't that sort of free up your brain? You're not seeing stacks of charts everywhere and kind of wondering, why is that stack getting bigger and not smaller?
Or can't find something, right?
That's exactly right. Yeah.
Yeah.
The ability to be able to just go to HR and not have to go through stacks and like, where is this, or did we forget to put it away, or whatever. So yeah, it is really nice. That's huge.
Awesome.
Well, it looks like we're out of time, and I know everyone's busy. So thank you so much to our panel for sharing everything. Special thank you to Lakeisha, Jolie, and Elizabeth for sharing your experience. If you would like to learn more about us at Patagonia Health, we are an integrated EHR practice management and billing solution designed specifically for health departments, even for ones that are super small, even as small as 2 staff. So if you would like to learn more about us, visit our website at www.patagoniahealth.com. Thank you. Have a good day, everyone.
Thank you, everybody. Thank you.